Awesome. So welcome to BHCOE's monthly business development series. Thanks so much for taking the time out of your day to join us for today's webinar about RBT burnout. My name is Christine Ratcliffe, and I'm the Quality Improvement and Insurance Specialist here at BHCOE, and I'll be the host of today's webinar. For folks who haven't yet attended one of our monthly webinars, welcome. Thank you so much for being here. For those who have attended before, welcome back. We're always happy to see that these webinars are a useful resource for you. I'm the one who curates the topics for these webinars, so if you have any suggestions or ideas for these, I'm going to put my email in the chat box, and if you would please let me know anything you have thoughts-wise as far as things you'd like to see, people you'd like to hear from, you know, criticisms, everything, any kind of feedback is great. Because the goal of the series is to help you guys as business owners and supervisors access relevant information that can help you run your businesses more effectively, more efficiently, and for an eye toward continuous improvement always. For those of you who aren't familiar with BHCOE accreditation yet, we're an accrediting body that is specific to ABA organizations, quite possibly the only one at this point. Accreditation is an important oversight component that allows an organization to be held accountable to a set of standards, in addition to the individual practitioner standards that we get from the BACB. It also provides a standardized peer review process for ABA organizations that allows them to benchmark their progress on things like patient outcome, turnover, staff satisfaction, and patient satisfaction. We take a lot of pride in what we do here at BHCOE, and with the help of our board of advisors and subject matter experts, we work to create a code that helps organizations positively impact their consumers. We were created by behavior analysts for behavior analysts to ensure that regulation comes from within the field and that we can stay unified in what it means to provide quality services. So if you're interested in learning more about BHCOE accreditation, please feel free to reach out to us. And I'm going to pop our submission form for our website, so you can email me and do that form. If you're interested in more information about BHCOE. So it looks like folks are getting settled in. So just a couple other housekeeping issues. Our webinar, as I mentioned at the beginning, this will be recorded. So we'll send out a recording to anyone who registered, and something to note is that registration is integrated with our mailing list. So if you haven't registered with us before, you'll now get updates about webinars and goings on with the BHCOE. And if that's too much email for you, we won't be offended if you hit that unsubscribe button. But if you're interested in more of these webinars, that's the best way to find out about our next one. So I would like to go ahead at this point and introduce Dr. Becca Tagg, our speaker for today. Becca has a dizzying amount of training in education, psychology, school psychology, behavior analysis, and psychopharmacology. Her doctorate is in clinical psychology from Alliant International University, and she's been a BCBAD since 2011. She's currently clinical director of Del Mar Center for Behavioral Health in Jacksonville, North Carolina, where she is joining us despite still being hunkered down for the hurricane. So we really appreciate your efforts to be here with us today so much. Del Mar offers ABA services alongside psychological services and speech-language therapy. So Dr. Tagg oversees a team of clinicians, including RBTs implementing ABA. And so that makes her well suited to speak to us today about the vitally important issues surrounding RBT burnout and how to prevent it. So with that being said, Becca, I will give the floor to you.
Welcome, everyone. I appreciate you guys taking the time out of your day to join me. This is a topic that is very interesting to me. burnout in our direct care staff and parents was a topic for my dissertation and research that I've done since then. A lot of that comes from my own experience, which we'll talk a little bit about. As Christine mentioned, my clinic is in Jacksonville, North Carolina. So if you've been putting the news on, you know that we are under feet of water. So I evacuated to Pennsylvania, so I am nestled in a front office at my aunt's house, and my dogs, I have 2 pugs there outside the door, having a little bit of separation anxiety. So if you hear them snorting or barking, I apologize and appreciate your understanding and flexibility in kind of everything that's happening. So I'm excited to talk about preventing burnout. While we're going to talk specifically about RBTs, really what we're going to be talking about is going to be applicable to any of our direct care staff. So our objectives for today, we want to get a good definition about what burnout is, identify some causes of burnout, learn to identify some symptoms of burnout. And because we're talking about organizational health, we want to understand how does burnout or turnover negatively impact organizational health, and then 3 practical steps to combat burnout. This is a lot of information for an hour, and it's hard to pare down what's most important. So I can make the slides available to Christine and Sarah afterwards that we can share. So why this topic? Why am I interested in this? And I think this image really speaks to why, and it's because I burned out. Part of the reason that I have so much training, I initially thought, oh, I'll be a school psychologist, it'll be great, kids spend a ton of time in school, I'll really be able to affect some change there. But if I could use Photoshop to make that, instead of say life, say systems or contingencies, that's exactly what happened. I spent about 6 years working in the public school system, and the reward for doing a good job was more work, more schools, more difficult cases, less boundaries between work and what's happening outside of work. And I burnt out. I started to really internalize that I sucked at this job, that I wasn't good at this, that I wasn't successful, that I wasn't making a difference. And it just felt bad. And so I decided that part of that was because the contingencies in place in the system where I was working. And so because of that, when I have created my own organization, it is of the utmost import to me to make sure that those contingencies are in place to truly support health and wellness for our staff so that they can truly do the best for the kids that we serve. So what is burnout? Maslach, who is sort of the guru when it comes to burnout research in the field of psychology, gives this definition about it being a syndrome of emotional exhaustion, depersonalization, and reduced personal accomplishment that can occur among individuals who work with people in some capacity. And so I really want to draw attention to that last sort of 5 or 6 words about it's people working with people. I also know that as behavior analysts, we want something a little bit more objective. We want a more measurable definition of burnout. And so the symptoms and behaviors that are often related to burnout are absenteeism, so frequent calling out, missing work, being sick, other physical symptoms, maybe back pain, GI upset, withdrawal from social interactions, negative, overt, and private language when you're talking about work, and then avoidance of work tasks. I can honestly say that at certain points in my career, I have experienced all of these, right? And that is a sign that we have burned out. We have some risk factors for burnout, and this comes from some research, again, in the field of psychology. A lot of the burnout literature started by looking at nurses and physicians, those high stress, or what we often think of as high stress positions. But Lord, working with kids with unpredictable behaviors can be stressful, because, you know, those commercials about deep couch sitting, right, when the guy's able to like lean back into the couch, we can't do that with our kids. We need to be on, and they receive intensive intervention. And so we have to be on all the time for extended periods of time. So maybe take a look at these risk factors, and maybe you identify some of these in your organization or the organization within which you work. High or unrealistic work demands, an imbalance between the need and the resources, conflict. Younger employees and single employees are at greater risk of burnout. Employees who define work as their primary source of feelings of accomplishment. That's a tough one, right? And that is directly related to higher levels of education, because oftentimes, we've done extra years of graduate school or college or training. And so our position or our occupation really becomes a defining factor in who we are. Longer work days, isolation or lack of social support, and challenging client behaviors. That was specific to some of the special education research, but I think that it applies for us as well. So the effects. Gosh, some of these are part of those symptoms and behaviors that I talked about in our definition. So not being there, then turnover, right? So not being there ever again, disruption of service for our kids and our families. Then there's often additional stress for those that do stay, right? So when somebody leaves, there are people left behind. And so I'm also noticing I left the chat box up, so I'm seeing information, I'm seeing notes come in, and I'm easily distracted. So Mara asks why younger and single employees have a higher risk. So I think it's probably both of those questions or sort of suggestions that you have there, hypotheses perhaps, right? So not enough time in the field. Well, time in the field is sort of objective, right, or subjective. So what does that mean? It's more that you don't have as much experience with managing the stress of the field. That comes with BST, right? So that behavior skills training, working with a mentor who can normalize the difficulties and then give you some strategies to support how to get through it, and then give you feedback on how you're doing to get through it, and then also modeling it. So they just don't, it's a new repertoire of behaviors that just haven't been learned yet. It's a great question. I think the single part is because, so when you go home, if you're single, there may not be somebody else there. I mean, that might be interesting research, right? So if you have a roommate, does that help ameliorate that as a risk factor? I'm not sure. So additional stress for those that do stay, and then poor performance by those that stay instead of leave. If you can think of somebody that you've worked with that people make jokes a lot about, oh, so-and-so's just waiting to retire. Well, that's a person who probably is burned out and they're no longer jazzed by being in their position. The cost of burnout is super high. There is about $5,000 per RBT or technician in turnover for time that's spent, the employee's time, other employees training them, client time is lost. I actually saw over at 3Pi Squared, they have a loss calculator that they just put in one of their blogs that you can type in like the amount of hours worked by the person, the amount of billable hours lost, and it'll give you a more independent list of, or a more individualized list of where you may be losing, so that might be helpful. For supervisory level staff, it's estimated to be 30 to 100% of annual salary. This comes from BSci 21. Some of their articles they've posted. I've also seen in other fields, it can be 200 to 300% of annual salary. I see David's note here about the large caseload size too quickly, and I think that's super sad, but that isn't always, so remember that the information I was just talking about doesn't just come from the ABA literature, and so other fields actually don't do that to their newly certified individuals. So for my clinical psych training, I really had, I did not have that experience. So I think that's a great contributing factor for specific to our field, and that's also one that would be easy for us to affect some change with. So it's a great thought, David. Thank you. So what do we do, right? We've identified burnout sucks. It is hard for the agencies. It's hard for the individuals who leave. It's hard for the people who stay. So what do we do? Well, guys, this is what's fantastic is we do what we do best, which is assess the situation, come up with an intervention, and then monitor to see if that intervention is working. So how do we assess it? Well, we want to use data because we are behavior analysts. So data, 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 right? So what are the missed sessions and call out percentages? Who is doing it more? What are the reasons? And not just for, so if a person's getting sick frequently, whether they're actually getting sick or calling out sick and they're not actually sick, there's an issue there, right? And so you want to talk about that to the person. Take a look at your IOA data. Is somebody's performance subpar for that individual? We also want to add in some additional assessments. The Maslach Burnout Inventory, Areas of Work-Life Survey, Values Survey, and then reinforcement surveys. These are the ones that we use specifically in my clinic and within my organization. That these come from literature that has showed them as being effective monitors and predictors of burnout and being likely to leave the field. There certainly are others out there. Again, this is a great opportunity to look outside of our behavior analytic literature and see what exists in the literature from complementary fields. So the Maslach Burnout Inventory, there's different versions of it. I use the Human Services Survey because it does identify some characteristics of our job that are specific to those of us working in the human service field. Takes about 20 to 30 minutes to complete. I would say that's a very conservative estimate. I would say a lot of my staff is completing it in closer to 15 minutes. There's about 22 questions, and it gives you 3 scales: emotional exhaustion, depersonalization, and personal accomplishment. The Areas of Work-Life Survey, I believe, complements the MBI, that Maslach Burnout Inventory, because it's got some areas of work life that when these are certain, so like workload, if workload is high, that's going to be potentially contributing to maybe emotional exhaustion, right? So these look at complementary domains, not measuring the exact same thing as the Maslach Burnout Inventory. Control, right? So if we have a low sense of control or locus of control as being external instead of internal, that may have a negative impact on sort of how we're feeling about work. Reward, community, fairness, and values. My staff actually completes this twice per year. And the Maslach Burnout Inventory encourages you to think about the last 30 days. So you could certainly administer it more frequently, and it's not something that's going to pick up change from week to week necessarily. We have something separate for that, but it is a more constant or more stable measure. Okay. We also include values questionnaires. These are some samples. There's lots of different ones. Again, it's a great opportunity to look just outside our behavior analytic literature. It's looking at different values that are important to the individual. So if I know that independence is a high value for a person, then I may be more likely, I can tailor their workload or teach their supervisor to help them tailor their workload to give them more independence, right? Because when we're moving towards our values, gosh, we feel great. We're moving towards our true north. And the more we can do that, the better we feel. So intervention, gosh, did I miss one here? Maybe it comes later. Okay, so we've done some assessment and then we want to intervene. And I think this is probably what most of you guys are looking for, right? What do? I recognize this is happening. I know this is a problem in our field, in my organization, and in my wherever I'm working. And what do I do about it? So I'm going to briefly go through some of the things that we use, and a lot of it is about peer mentorship and connection. So we have what we call the RBT support committee. We have a small group of RBTs, and again, they are the RBT support committee. So we identified these individuals because it's what they're interested in. So it's a way to diversify the regular, right, run-of-the-mill RBT role, and how do you switch that up to help individuals move towards their values? Well, for these individuals that we use, part of their value is a sense of community and caring for others, right? So by helping them move into this support position, they're able to check on their peers. So they each RBT in the RBT support committee. They check in with each other weekly, I guess bi-weekly. And then every week, every RBT at Del Mar Center for Behavioral Health gets an email or a text or a phone call from their support committee member asking them how they're doing. How's your week going? What's working? What isn't working? Do you need me to pass anything along to Dr. Becca? Do you need to pass anything along to another BCBA? How are things going? So everybody gets that. The RBTs get to determine how they want to receive that. So if they want to chat, then maybe they're going to ask for a phone call. Not everybody wants that, right? So what's their value? If they just want a quick check-in and they're getting their social needs met elsewhere, fine. We don't want to push them into doing what we say or what I think is right. I want to give them options. So maybe they just say this week is fine. And then each RBT reports to their support committee member how their week was on a scale of 1 to 5, 1 being the worst week ever, 5 being fantastic. And then we plot each RBT's week over time so that we can look for trends. Remember, 3 data points is a trend, 1 is just an outlier. So it's not that everybody has to be at a 5 every week, right? Think about The Happiness Trap by Russ Harris. That's what gets us stuck. It's not going to be butterflies, roses, and unicorns all the time. That's unrealistic. It's about, are you in the middle most of the time? That's why it's called the mean. Each RBT support committee person has 6 people that they check on. We found that more than 6 is just too much for our organization. But again, that was kind of a trial and error sort of thing for us. What felt like too much, what didn't feel like enough. Those RBT staff are paid for their support committee duties, and it's not billable, and for us that's an investment in the health and wellness of our staff. We also do RBT roundtables. These are held every 2 weeks. Everybody has to attend 1. You can attend 2 if you want. They're paid. They're led by either a senior RBT, or lately we've got quite a few people out on maternity leave, so I've been helping out by doing 1 a month. This is really, we have a group of RBTs get together, and it's really a sort of a support time. You know, with HIPAA and confidentiality, you often can't go home and complain about your job or talk about your job or celebrate your job because you can't give identifying information. And yet you have to get that stuff out. And so what we do is we create a safe place to do that so that our RBTs are less likely to break confidentiality and you know, potentially be talking about things that aren't appropriate. And instead of just telling them don't, we are giving them an appropriate place to do so. And it's also a great time to, again, sort of take the pulse on how is everyone doing. We feed them during the time, so we provide snacks, and sometimes it's like make your own salad, bring your own protein, something like that. It's not very expensive for the organization. The staff love it. I mean, they really love, and we consistently get feedback that they love having these roundtables. It's support for them by their peers. Sometimes, you know, like a BCABA will help run it, or like I said, I've been running it. Sometimes we'll talk about a specific topic, like we spent some time talking about culture and using the addressing model. Pamela Hayes' addressing model, which comes from the psychological literature, about recognizing and identifying culture in others and self so that we can be making culturally sensitive and culturally informed decisions for ourselves and each other and our clients and families. And so there may be a topic that we're discussing, but even when there's a specific topic we're discussing, there's always time where the majority of the time is spent talking for what they want to talk about. I'm seeing lots of sort of feedback coming in. You find it difficult for in-home therapists to meet at one location. We do in-home and clinic-based. You require it. This is not optional. So, I mean, this is just not optional. This is not an optional program. Part of your employment includes at least 1 roundtable per month. You can attend both. It's paid. I mean, it's not an option. So you, as an owner or leader, you set up the contingencies to make that happen. So yes, we do the best we can to make it easy for people or decrease barriers, right? So we usually hold one first thing in the morning and we hold one in the evening after sessions, right? So we're open 8 to 5. I know some places are open much later, but again, as we'll talk about, that's part of not burning staff out. We close at 5 because they need to go home with their families. There needs to be a discrete end point to their day. And when we close at 5, there's enough time for them to still do these extra things after work, whether it's stuff for themselves, to get to their own kiddos, softball games or soccer games, or have dinner with their family, spend time with their husband, decompress after work with enough time to return the next day. Okay. So another way to intervene is increased training. So when we don't feel like we're good at our job, we are also more likely to burn out. So this is more focused on not the social aspect, although there's a social component to it, but it really is skill acquisition. So once a month, we cancel sessions. So for us, we do it the last Tuesday of the month from 8 to 10 a.m. All sessions during that time are canceled, and we have a monthly education event. We use behavior skills training, so BST, we know that works, so that's what we use. And we work on a variety of different behavior analytics skills and techniques. We come together as a group, so I would say probably a chunk of the time is used for specific training on behavior analytics skills and techniques. And then we'll also do training on, so the comorbidity of seizure disorders and autism is high. So we also do a seizure training. It's also built in time to update your CPR training if you need to do that. It's time for those CPI or safety care refreshers. It's time to check in about administrative processes, but that's the time that we hold sacred for our team. We also train to mastery, not a preset amount. And so sometimes we'll say, well, so think about the RBT training, right? So you get 40 classroom hours of behavior analytic training. Well, so what? What if I can learn it in 40 hours and person C can't? Well, then I've not done an adequate job training them, right? And if you think about what we do in the educational setting, we, those of us that advocate for our kids, we want to make sure that they're getting what they need to be successful, not that everybody gets the same thing. So you want to have these built-in mastery checks. This can be great work for your BCBA, so we call ours residents, like people who are in graduate school for behavior analytic coursework hoping to become a BCBA. So this is a great opportunity for our residents to get some unrestricted hours, practicing teaching other people, practicing taking IOA data, right? But really building in these mastery components to ensure that staff are trained to mastery, not a preset amount. So I guess that's more about it not being a one size fits all. And guys, remember, we know this stuff works because this is what we do for our learners. This is a lot of times just about doing what you're already doing as best practice for your kids, and what you need for your staff. Okay, so I see Michelle's asking, how do you balance I'm guessing this is referring to closing at 5. So my job is to take care of my staff. And the literature consistently shows that these long work hours and working till late in the night is not good for our staff. And I haven't looked specifically, but I would also guess it's not great for our kids to be in school all day and then come to intensive hours after school. So for me, that's me setting the boundary. That's me saying, this is what is best for my staff so that the families can get high quality service. Families always have the option to pull their kids from school to start ABA early. And so if they're not happy with sort of a 3 to 5 or 3:30 to 5, or gosh, hell, even 4 to 5, if they're not happy with that, then they have a couple options, right? They can choose to pull their child maybe an hour early or from school to be able to start sessions early, or they're also able to choose another agency that may be a better fit. And I don't mean that in an ugly way, right? This is me setting the boundary of what I have learned works for my staff. I have to take care of my staff. When you're the leader and supervising other people, my most important job is to take care of them so that they can provide that high quality service for the staff, for the kids and families they're serving. And this is pertinent for me. So when I was in my pre-doc internship, I had a supervisor who would tell me that work-life balance is important. oh my gosh, I'm actually feeling myself getting emotional even talking about it. So she would tell me how important work-life balance was. And then she was in charge of my schedule, and she would schedule me for 8 a.m. patients and 7:30 p.m. patients. And I remember how much I couldn't understand, why is she saying this is important? And then she's actively doing things that go against this. I didn't trust her. We didn't have a good supervisory relationship because I didn't trust her. She's saying one thing and doing another, and that does not build rapport. It doesn't build trust. It doesn't build psychological safety, which is an important component of supervision, so that I could come to her and tell her when I messed up. I just felt like it sucked, and I'm not going to do that to somebody else. And so then it's up to me to make those difficult decisions. Does it mean that we lose out on money as an agency sometimes? Yes, because we're closing earlier. We are not open on Sundays. We only do 2 Saturdays a month. We do not start before 8 a.m. and we close the last Tuesday of the month from 8 to 10 a.m. That is a loss in revenue, and it's a huge investment and a huge profit in taking care of my staff. Okay, so I think I'm taking too long. All right, so another way for intervention, this gets back to that BST, right? These are the steps from Denny Reed, who is from North Carolina, so Tar Heel State. He is the go-to person in my mind for a lot of this managing human service staff. If you don't have his supervisory books, put them in your Amazon cart. They'll be to your house in 2 days, and they are absolute gold. We use them. I use them personally, as well as I use them as part of some of the graduate courses I teach at Ball State, and our residents. Remember, those are our people who are in graduate school for behavior analysis, hoping to be BCBAs. Some of their rotations include work of his to better enhance those skills. So we want to use evidence-based practice, not just for our kids, guys. Our staff deserves it. We deserve it. So this comes directly from some work that he's done. This is using BST in a group format. So this would be like our education events, but you also can do behavioral coaching, and that would be kind of one-to-one, right? Some people, let's say I'm working with person B and she gets it in 2 hours, and man, I'm still struggling. Then my supervisor notices, gosh, Becca's struggling. I need to do some one-on-one coaching with her. And so it's a way to differentiate instruction, just like we do for our kids. Guys, this is exactly what you know to do with your consumers, your patients, your clients, your families, your parents. We're taking those same skills and techniques and applying them to our staff. So other ways that you can intervene, we talk about those professional development. We have on-site CEs. So while we're talking about RBTs, y'all, BCBAs are in danger of burning out too. And so we want to be sure that we're filling their cup as well. So we have supervision seminars for our BCBA staff. Our BCBAs create blueprints, these SMART goals, right? We know what SMART stands for: the specific, measurable, achievable, time-bound, and realistic. Because when we're moving towards our goals, remember back to those contributors to burnout, those risk factors, that is moving away from our goals. So if we have goals and we're actively, I set goals, right? So I'm modeling setting goals. I'm talking about setting my goals. I'm holding their feet to the fire to set their goals and to move towards them. That builds a culture of moving towards values and goals. And when we are moving towards our goals, then we feel good about what we're doing. We feel rejuvenated. We feel like I'm part of something that's making a difference. And then we also have our clinical rotation. Again, we call them residents, or a residency program. It's modeled after my training as a clinical psychologist, where you kind of dip your toe into a variety of different things. So I guess I can talk about that for briefly. So our residents, they get a rotation in speech therapy, a rotation in occupational therapy, a rotation in what is considered the soft skills, which I actually think are the make or break skills of a BCBA. So those active listening skills, the summarizing that listener repertoire as well as your speaker repertoire, right? Both of those are important. And so kind of a rotation learning about that. They get a rotation about insurance and funding and clinical writing and a variety of other things, so that hopefully we are proactively working so that our new BCBAs are not towards burnout because they already have the skills they need to be successful, or at least the beginning of those skills that they need to be successful as a BCBA. And I wonder if that also connects back to what David mentioned about those super high caseloads as soon as you pass. Well, that's not as a concern if you've got more of those skills from the beginning. I mean, you still don't want super high caseloads ever, not just in the beginning, but when a person has the skills they need to be successful from the beginning because they learned about them during their training program or their training piece, then they are less likely to burn out. Okay, another intervention is self-care. And guys, this is not just, yes, there's self-care one-to-one or like how I'm caring for myself, but we need to infuse it into the organizational culture. Remember my supervisor in my pre-doc internship who was saying self-care is important, and then she was scheduling me for a 7:30 a.m. or an 8 a.m. and then also a 7:30 p.m. patient. So it just, you've got to mean what you say and say what you mean, and then take that committed action towards those values. So what in the world is self-care? I think it's a buzzword that people hear a lot. And what is it? So it's really any activity that's done intentionally. That intentionality is so important. And it's to take care of ourselves, whether it's mental, physical, emotional. It's related to or connected to improved mood, decreased anxiety. It can be team building, right? So you can have these teams that are doing things together, but it doesn't have to be, right? You also need to take care of yourself. Self-care is not selfish, and we cannot serve from an empty vessel. Organizations must follow through with the behaviors that move employees towards self-care, not just say it's important. So when I say self-care is important and then I'm scheduling my patients or I'm scheduling my staff to work 6 days a week, I'm saying one thing and doing another. I'm saying it's important, but it's not important for you. Right? Because I'm doing something that's not aligned with what I'm saying. And that can be really confusing. And that doesn't build trust and rapport. And that is so important in a supervisory relationship. Because as a supervisor, they're trusting me to help them set those boundaries. And if I'm modeling for them to say it and not do it, what do you think they're going to do? Same thing. They're going to say it and not do it. And that committed action is what's most important, that committed action towards your values. Here's an example of our July. So we do a variety of different things. We have small groups that do activities together. Like we did a, what do you call it? Yoga. When you bounce on other, you like sort of get picked up by other acro yoga. So that was us trying something new together, and only a couple of us did it. And then this was we did a self-care was the focus of July, right? It's kind of at the end of the school year, but before the new school year kicks in. And so we really boosted our self-care activities. And if you're a member of the ABA Business Builders group, then you probably saw this shared in there. And then we talked about it. So I didn't just make this and hang it on the fridge in the office. I brought in items to help the girls stick with some of this. So one of them was like drink more water, and I brought in some like spa water stuff. So like ginger and lemon so that they could make spa water. And right, the addition of lemon and ginger. So I think I spent $20 on lemon and ginger, and the girls talked for 3 days about how awesome it was to have it there. Because spa water drank normally is still this like, you feel fancy or cool or awesome, or they felt cared for, right? So we talk about pairing with our kiddos, but let's also pair with our staff. So every time they took a drink of that spa water, it was, Dr. Becca cares about me. This is something different. I'm important. And I want everybody, not just within my organization, but I'm in charge of my organization. So it's up to me to make sure it happens there. I want everybody to feel taken care of and important and valued. And y'all, I've spent more on less. So $20 of lemon and ginger, that is money well spent. Okay. Another way to intervene is to make sure that our reinforcement is reinforcement. So have you ever worked somewhere? I read this, I think, in one of the other ABA groups on Facebook, and it was this idea that somebody had posted that they were getting these $5 gift cards for Starbucks from one of their supervisors, and that the person was so offended by the $5 Starbucks gift card because she was having a hard time paying her bills because her hours were so inconsistent, that something that the supervisor, I'm sure, meant to be reinforcing was punishing. And so as frequently as we assess items and activities for their reinforcing value for our clients, we have to do that for our staff. So this is the one that we use. It's part of our onboarding activity, or part of our onboarding packet, and then we have staff complete it periodically to update, so that we can be sure when staff are being reinforced that it's actually reinforcing for them. We also have strict boundaries between work and non-work time. I encourage our BCBAs to use something called Boomerang that I learned about from Josh Pritchard, which has been a game changer for me. So when I'm responding to emails, I often do work later because as the owner of the business, I signed up for that, right? And or at least 3 days during the week, I work later. And so I don't want my staff to be getting those emails at 8, 9, 10, 11 p.m. So I got this Boomerang. It's an add-on, I don't know the right word for it, from Google. It's very affordable, and I can set it so that my staff do not get the email until the next day during business. And that's super important, because if I say that I don't want them doing work when they're not at work, but then I'm sending them work to do when they're not at work, remember, I'm saying one thing and doing something different, and that sucks. And I also hope that I'm modeling for them the boundaries, that I'm saying when you're not at work, I don't want you working, and I'm not going to let you get those emails. I'm going to take steps, some antecedent strategies to be sure you don't get them. A note that if you do that, be sure that you are not sending all of them at 9 a.m. the next morning, or else then you turn 9 a.m. to be this like super punishing time. And so sort of stagger them throughout the day. Same for weekends. I don't want people working on weekends unless they're scheduled for a Saturday. And then praising and reinforcing staff for sticking to that, right? Because sometimes inadvertently we say work-life balance is important, and then we really praise and reinforce staff who are working like dogs. And we got to do the opposite. So when my staff is working and I'm getting emails from them late at night, I'm going to want to check in with them. Gosh, I noticed that you're sending a lot of emails late at night. You're doing a lot of work at night. Let's check in about that. Is there something I can do to help? Do we need to spend some time talking about time management? Does your caseload feel too great? Can we streamline something you're doing? Do we need to take something off your plate? So really talking with them. And again, if work-life balance is a value, then I need to be taking committed action towards those values. And if a lot of that sounds like ACT language to you, acceptance and commitment therapy, that's probably valid. I certainly am a ACT-oriented psychologist. And human, I think it's important. So we've assessed for burnout, we've intervened to decrease the burnout. Now what do? Continue to take data. This is like a value, right? We're never going to be well enough, right? What does that mean? So we want to constantly be assessing it, and we take data. We want to be making data-based decisions. So ongoing data analysis, we want to re-administer those measures periodically. So that's that Maslach burnout inventory, the areas of work-life balance, and then ask them. So I use SurveyMonkey on the regular. Ask them, how are things going? What do you need? Ask them, how are they doing? I can do it anonymously through SurveyMonkey. I've got my RBT support committee that's got their finger on the pulse of all of their RBTs that they are supporting. We've got the data of their weekly surveys that they're reporting. So we've got quantitative and qualitative data. We want to be using all of that. We actually use BHCOE as another monitoring option. So as Christine talked about, you guys are probably familiar with what BHCOE is. That's why you're here. We went through the process in November of 2017. And this is total vulnerability moment, because I'm sharing with you some of the results that we got. And so our employee satisfaction, I love that BHCOE uses employee engagement. A lot of the literature uses that language. Somebody who's engaged is doing well, right? So it's not just satisfaction, because some things people are not always going to be satisfied with, right? Like compensation is going to be one of them. You're never going to make everyone happy. And an employee who's engaged is an active member of that community. And when people start to disengage, that's usually an indicator that things are going not great. So you can look here that our scores averaged about 90. Our range was 80 to 96, and you can see that we are doing really well. Our employees are engaged. We also use this, so benefits was something that people weren't happy with, or they were the least happy, relatively speaking. So we beefed it up. I mean, we beefed up their our benefits package. And so I look forward to, we actually took some of the survey questions from the BHCOE survey, which is much longer, and then we sort of boiled it down to a couple key questions, and we administer that quarterly to our staff so that we can look ongoing. Here's our employee snapshot. Look, y'all, this makes my heart grow 3 sizes bigger, like the Grinch at Christmas, 100%. And then I love that it shows the industry averages, because I'm hard on myself. That's one of my own growth edges, my own self-compassion. I need to work on that. And so I will go right to the area that's not going well. And if I've got like a 98%, I'm like, but what's that 2%? How can I make that better? And so being able to see the industry average helps me to balance. Yes, I always want to be doing better, right? We always want to be leaning forward and improving. And we have to simultaneously recognize where we are. So I feel good about these scores, and these are employees. Like, this is them giving anonymous, candid feedback. So this is how I determine, is what we're doing working? Our technician turnover rate, so I'm sharing this as well. We do have, so in 2016, we had less than the average of turnover, which is not surprising. I moved back to North Carolina in 2016, so we were much smaller. 2017, we had twice the normal, or twice the industry average of turnover. And remember, one data point is an outlier. So then you want to do an error analysis, just like we do with our kids. And for us, we live in Jacksonville, North Carolina. So we are at the largest Marine Corps base on the East Coast. We employ a ton of military spouses. We are always going to have high turnover. So I took our numbers and went back and looked at why people are leaving. 90% of our staff that left because they got PCS, a change in duty station, so a permanent change of station. So they're not leaving voluntarily, they're leaving because the Marine Corps or the Navy tells them they have to go. So this number is not as important to me, right? Not that it's not important. It is not an indicator of just the number. The number is a number, right? You need to do that error analysis, or that analysis of that number. What does it mean? Our hourly rate, right? So I looked back, and one of the areas where staff said, we're not 100% satisfied with was their technician wage. So now I can look at this. Is that valid? Are we paying within the average? And we are, and our cost of living is low. So I can lean into the fact that I'm never going to make everyone happy, right? People always are going to want to make some additional money. And so so I'm okay with that. We are within the mean, and our cost of living is on the lower end. Okay, I'm mindful of time, so I'm trying to sort of finish up here. So response to that progress monitoring data, it depends on the data. If it's what you want to see, keep doing it. If you see something that's not a good fit or isn't what you want, the fantastic thing is, just like we do with our kids, remember that parallel process. Come up with a different intervention plan, implement it, and assess again. And if the data moves or trends in the direction you want to see, fantastic, keep doing it. If you see that the trend is not in the direction you want to see, change it. You are limited only by your creativity and imagination. Okay, I love this. Well, I love a lot of quotes, as those of you who either listen to the podcast or in the Business Builders group, you guys know that. So of course, it's only fitting to end on a quote. Creating the culture of burnout is opposite to creating a culture of sustainable creativity. This is something that needs to be taught in business schools. This mentality needs to be introduced as a leadership and performance enhancing tool. Ariana Huffington, so HuffPost, I think she is doing that. So questions, comments, my websites are here, my email is here, and I'm going to open up the chat box, and we will see what happens here. Okay, let's see. Oh my gosh, so much information.
Awesome. Well, and I'm going to hop on here
Yes, thank
too.
you. I appreciate that. Thank you.
I've been, so I've got some Q&As, and
Okay.
then we can hop over to the chat as well. So there's a couple Q&As from earlier in the presentation from Monica. One is about the assessments that you were talking about at the beginning.
Yes.
And she asks, are those completed before hiring? And do you administer any test or inventory as part of onboarding?
Yes, so everything I shared is part of our onboarding process. Those are not
Okay.
free domains, so I just typed in, it's Mind Garden is where you can purchase. Gosh, I feel like I just got loud. Mind Garden, I'm just excited. I get passionate. I like love all of this stuff. So
Yeah,
Mind
it's
Garden
fine.
is where you can get a license to be able to administer those, a license as in a copyright license. Please do not copy and paste it from research that's been done, guys. People spend a ton of time creating and validating these measures. So please spend, it's like $100 or something for the year to be able to use these measures, and then you can score them very easily. We give them at onboarding and then periodically throughout the year. So yes.
Awesome. Thank you.
Mm-hmm.
And then another question is, how can we start doing all these, the awesomeness, which is great,
Oh, yay!
how can we start doing all of that since the beginning when their organization is small? So I think they have a small organization. How can they get started on this kind of support for their employees?
So I think that's a great question. And it reminds me of the Shel Silverstein poem, How Do You Eat an Elephant? One Bite at a Time, right? So pick one thing, implement it. When you've got that down pat, pick something else, implement that. Get clear on your values. What is most important? What aligns best with you and your organization and the vision you have for it? And then pick an activity or something from what we've talked about, or gosh, come up with something better, and then implement that, and then slowly start infusing it, right? It's like when you make those spa waters, you don't drop a lemon slice in and all of a sudden it's spa water. It's got to marinate, it's got to cook it, it's got to become spa water, and so pick one thing and do it, and then add something else. And if you're not sure where to start, I often call that paralyzed by perfection. Like the first time I went to Starbucks and I was like, oh my God, they don't even say small, medium, large. I don't even know what to do. So I'm out, right? You just ask your staff, give them 3 options. We can do the round tables, we can do a support committee, or we can do whatever. Ask them what they want to do, because then you've really got buy-in, right? Because you didn't make the decision and pass it down. They're deciding what they want. And that's fantastic. That's powerful.
Wonderful. All right. Well, there's been a few others on chat here. So Mara had asked, with practicum students, their workload is high because they're in the field providing practicum work in indirect and direct. So they have, she sees them having more stress and burnout than people who aren't in school. Do you have any suggestions for that?
Yes. So we have I would say currently 60% of our RBTs are actually in school of some kind, whether it's for speech, for OT, for psych, for ABA. As a supervisor, you just got to check them more often. And a high workload is not the same for me as it is for Mara, as it is for Christine, right? Because we all have different things that we're good at and different things that are growth edges. And so instead of doing that one size fits all, like everybody gets this and does this, really individualize it. Maybe somebody's really good at the intervention piece. Great. So then they're doing that, more of that, whereas somebody struggles with the intervention and is a better writer. So then you can sort of flip their percentages. But it's that differentiation, it's that individualization. Increase the supervision percentage has a huge benefit. Our staff get about 20, so we aim for 22 and we're landing at 18% supervision. And so that is a huge benefit, because what initially feels like independence quickly turns to isolation, and that's problematic. Then we're already taking steps towards burnout. So increased supervision, differentiating for them where they're at individually. So I guess meeting each person where they are.
Wow, that's so important. So for your roundtables, where Mara mentions it's difficult to get in-home therapists in one location. So are you dealing with just clinic RBTs or in-home RBTs?
No, we've got both. And we've got both. And I think I had mentioned to her, like, it's just not an option. You have to be there. It's paid. It's not an option. You got to be there. This is a part of your job. Yeah.
Excellent. And Jennifer asks, we get a lot of blank stares or non-responses from open-ended questions. Do you have suggestions for more direct questions they might use?
Yeah, so
I
I
think
will.
she's talking about the surveys and
Yes.
things.
So part of that I would say is, well, I guess my response is twofold. I'm having the thought initially that in the beginning, you get that because they don't think you're listening, right? And so the more you begin to infuse this frequency of the two-way street, the giving feedback and getting feedback at all directions, when people feel heard and important, they're going to be more likely to give that feedback. So that will come initially, and sort of to combat that, what we also do is that's where we have that number question. How was your week? 1 through 5. We also ask questions like the BHCOE engagement surveys have things like it's a statement and that it's very strongly agree to very strongly disagree. So you can set it up as a Likert scale if that's easier, and then move towards those open-ended questions as the practice or the behavioral repertoire of giving and receiving feedback across different levels of your organization becomes stronger.
All right, wonderful. And let me see what else we have going on here. There's a few other questions. Now, somebody asked, what is your podcast? I want to get that out here.
Yeah, it is the Business of Behavior podcast. And if you go to the Business of Behavior, that's my website. So I do, in addition to being a sort of owner and clinical director of our multi-specialty practice, I obviously love what I do as far as this, and I get really jazzed to help do some consulting with some agencies who are looking to improve the culture of their organization. And so I started the podcast just because I think that was helpful. And so if you go to the Business of Behavior, it'll talk a little bit about the consulting. I do speaking engagements, and then under the blog link, there's a bunch of the podcast sessions that are also available on iTunes and Stitcher. Big thanks to Matt Sikoria for teaching me how to use Stitcher, because I didn't even know that was a thing. So yes.
Yes, everybody's all about podcasts these days. It's wonderful.
Yeah.
All right. So I want to be mindful of time and not keep you after. And so I don't know that we'll get to every question here. But somebody did ask upstream about some of the references that you referenced in the beginning. That I think are more from the psychology literature. So if it's all right, and I want folks to know that we'll do this, maybe later today we can trade some emails about those references, and then
yes, I also have this whole list here of references that will be helpful.
Oh, well, there you go.
Yes,
perfect.
Neuroses
Look at you.
Yes, there are. If there's anything else, I mean, gosh, I don't put my email address here just for show. Please feel free to email me if you have any questions. If it's a brief question, I'm happy to respond. If it's something that needs a longer time and attention to really give it the attention it needs for you to get what you're looking for, I will either talk about where you can get that information, or we can talk about some consulting, or refer you to somebody else who does consulting. I mean, I'm happy to, right? And I guess, why do I say that? Because I don't want to be saying that I'll respond to all emails and then people think I will, and then I'm not keeping my own boundaries, right? So if it's a quick and easy answer or minimal, I'm happy to help. I wouldn't be where I am if people hadn't helped me. And so that, again, was the whole purpose in creating the Business Builders group and the podcast, was to make available what I wish existed when I was getting started. And so I'm happy to help. And I also want to be, candid in that I do prioritize my work-life balance as well. And so I may not be able to help as thoroughly in a sort of quick email, and we can talk about what options might be options if that's the case.
All right. Well, wonderful. That's great. I love that you just have a set of references right there. And then you're going to share the slides with me, and we can make them available to attendees. And so they'll have those resources there. That's fantastic.
Yes.
Well, thank you so much, Dr. Tagg, for doing this for us today. There are a whole bunch of thank yous and wonderful statements in the chat box if you haven't been able to keep up with it. So it sounds like everybody has really enjoyed hearing your your take on how to support people, and
Thank you.
we really appreciate you being here.
Thank
And
you.
you've got a couple requests for presenting this at ABAI. So
You know what? I
keep
did
that
it.
in
I
mind.
submitted it to present something similar, and I wasn't
Wonderful.
accepted. So we will try again next year because everything is different. You know, it's always different. And I appreciate the interest. I agree that it's important, and I appreciate that feedback.
All right. All right. Well, we'll see if we can get if they'll take it next time around,
We'll see.
or
We'll
at
just
another
keep
conference.
submitting it. Absolutely. All right. Thank you guys so much. I just want to say I know that time is our most valuable resource, and you guys choosing to spend it here. I mean, just the number of people involved just really it's awesome. So I appreciate that. And big thanks to BHCOE for putting these on for people. I think, you know, being able to put that information out helps us be better, helps our science, and that ultimately helps the families we serve. And that's everything.
Absolutely. Well, thank you again so much for being here, and to our attendees for being here as well. We couldn't do any of this without you, and we'll let you go ahead and get back to all of the important work you do now. So thanks so much, and have a good afternoon.
Thank you. Bye-bye.
All right. Thanks. Bye.